Yeah, no, that's great. And I think there's another slide next, which essentially is taken again from the British Islamic Medical Association, that is help to kind of guide how we think about this. Now, one of the first things to remember is that side effects on these vaccines remains very low. You know, there aren't a huge amount of side effects. And the side effects are fairly mild for people that get them, similar to any other illness. And that's a mild illness, which is how these vaccines work. You know, they're trying to create an immune response without getting the real infection. So you're going to expect to get some kind of inflammation responses, so some aches and pains, some fever, might get a bit of a headache, etc. So the way we need to think about this is, you know, do we feel when we are normally fasting in other times of, you know, in other Ramadans, have we managed to fast with a mild infection, a cold, and have we continued fasting? And if the answer is yes, then technically there's nothing to worry about the side effects, because most people will get mild side effects and can manage to fast anyway like they would normally. If, however, maybe you're somebody who is very sensitive to illnesses, and even in the past, you've had kind of a cold and had to stop fasting because you really struggled with the symptoms, then maybe that's something to consider, that if you develop those symptoms, you get unwell, then you break your fast, but then you make up your fast afterwards. It goes back to, you know, Qari Asim's point that preservation of life here is really important from an Islamic perspective. So the obligation to help end this pandemic collectively is really important. And we have provision within Islam to make up our fast if we get ill. So we should follow the same idea that if we feel unwell, that we cannot fast, we break our fast and make it up. That shouldn't stop us taking the vaccine. The side effects shouldn't concern us to prevent us from taking the vaccine, because we have provision within Islam to make up the fast if, on the rare occasion, we feel unwell enough that we have to break it after the vaccine. I hope that, again, makes sense. Again, the BIMA website has some great resources there as well for us to look through.